protect community. All right, and I will share your slide.
Thank you. It's so good to be back at an Eyes on Shell meeting. These are definitely meetings that really nobody wants to miss. They're really very important to keep updated on what's happening in this region regarding Shell and everything around the Shell cracker plant. Just waiting to get some slides up and we will get going. I'm going to be talking about the 3 studies that were conducted by the University of Pittsburgh. We have some folks from the University of Pittsburgh with us tonight, and perhaps we can get some comments from them and certainly answer any questions that you might have in the audience. But if we can go to the next slide, please. I really want to briefly review how we got here. You all know about the Human Toll series done by Dave Templeton and Don Hopi from 2019 that covered 27 cases of Ewing sarcoma, a very rare and frequently fatal bone cancer in young people, and 40 cases of other rare childhood cancers, for a total of 67 rare cancers in children, teenagers, and young adults, all over a 10-year time span from 2008 to 2018. Next slide, please. Now, there are only about 200 cases of Ewing sarcoma diagnosed in the United States every year. In Washington County, where I live, is Pennsylvania's most heavily fracked county. 6 cases of Ewing sarcoma and 30 other rare childhood cancers were counted. These numbers are far more than would be expected to occur in a similarly populated, mostly rural area over a 10-year period. And new cases keep popping up in this region. Parents and physicians are very concerned that pollution and toxic waste from fracking operations may be to blame for this outbreak of rare childhood cancers. Next slide, please. So 6 months after the Templeton and Hopi story was published, I had the chance to go to the State House along with dozens of other concerned community members. We spoke with Governor Wolf and other lawmakers and demanded a thorough and transparent investigation into the causes of these rare pediatric cancers. And lo and behold, 4 days later after our visit, Governor Wolf announced the creation of 3 studies to be conducted by the Pennsylvania Department of Health and the University of Pittsburgh. 2 studies examined health impacts in heavily fracked counties in southwest Pennsylvania on birth outcomes and asthma, and a 3rd study examined the plausible link between fracking and those rare childhood cancers. Next slide, please. Actually, if you can go to the next slide, that'd be great. So this is what fracking looks like in Pennsylvania, the 2nd largest natural gas producing state in the nation. We've got a lot of fracking going on, about 14,000 active shale gas wells on top of the hundreds of thousands of uncapped, abandoned conventional oil and gas wells, some of them drilled more than 150 years ago. What we're seeing in Pennsylvania is what we see everywhere. Holes are drilled and oil and gas is extracted. A lot of sick people. I think by now it should be clear to everyone that drilling holes in the ground has terrible consequences when it comes to human health and the survival of our species. It really is something that humans should stop. I also, before I go to the next slide, just want to remind everyone why fracking has expanded so rapidly in Pennsylvania. If there was no fracking, there would be no Shell ethane cracker plant. Next slide, please. So this is what fracking looked like in 2020 in Washington County, where I live. So it's a lot worse now. Washington County is Pennsylvania's most heavily fracked county. Pink balloons represent well pads that have multiple wells on them. White balloons are pipeline pigging stations, at least the ones that I could find on Google Earth. Yellow thumbtacks are compressor stations. There are also massive gas processing facilities in the county. It's not just one gas well or compressor station or processing facility that threatens the health of people living in this area. It's the aggregate of all of these sources of pollution that threatens their health and safety. Next slide, please. The Fracking Science Compendium contains more than 2,000 research studies and articles showing how harmful fracking is to the health of residents, workers, and communities nearby, as well as threats to the health of the environment and the planet's climate system. Many of the studies and investigations were conducted in Pennsylvania. The next edition of the compendium will be published this fall, and the conclusions are the same. Fracking has never been done safely anywhere, and it can't be done safely in Pennsylvania because it is inherently dirty and dangerous. Next slide. So let's turn to the three studies that the Pitt researchers did. Before we do, though, I do have to mention that I served on the University of Pittsburgh's external advisory board for the three health studies. The group was a sounding board for the researchers as they designed and executed the studies. The board met about half a dozen times in 2021 and 2022 while the studies were being conducted. I'm also a member of the Cancer Crisis Coalition, which has been meeting virtually with the Department of Health every quarter since 2020, when Dr. Rachel Levine was the health secretary. And the topic is centered around all those rare childhood cancers I mentioned earlier. We've established a good and productive relationship with the DOH over the years, and I expect those meetings will continue into the future. The researchers from Pitt explored the link between fracking and asthma, cancers in childhood, and birth outcomes in people living in an 8-county area in southwestern Pennsylvania where fracking is occurring. As I just mentioned, there is already abundant evidence showing harm from fracking in Pennsylvania. Birth outcomes are easiest to study because of the relatively short duration of pregnancy. Many studies already link fracking with complications of pregnancy, including pregnancy-induced hypertension, low birth weight, small for gestational age newborns, and prematurity. Other studies show an association of fracking and cancer in children, including last year's study from Yale University showing that young children living within 2 kilometers of a fracking well in Pennsylvania had 2 to 3 times the odds of developing acute lymphoblastic leukemia. Fracking has also been associated with severe asthma and increased hospitalization rates for asthma in adults who live near fracking activities. When you look at these studies, remember that public health research is designed to find correlations or associations and not establish causation. But also know that doctors don't wait for absolute proof in order to help their patients prevent or treat disease. And there is plenty of precedence for governments to pass laws to protect the public, even without having absolute proof of harm. The industry forgets that when they insist on absolute proof, and we have to make sure that they don't get away with that. Next slide, please. Now, for the asthma study, the researchers used electronic medical records from UPMC. They discovered that people living within 10 miles of one or more unconventional gas well, those people had 4 to 5 times the risk of having a severe asthma attack, being seen in the emergency department or needing hospitalization compared to people living more than 10 miles away. The biggest association was seen not during the well's construction, which can take a few weeks, or during the drilling and fracking phase, which takes several weeks or maybe a few months. But the biggest risk was later during the production phase, when gas is flowing out of the well to the surface. The production phase lasts for many years, even decades, after the drilling and hydraulic fracturing of the shale is completed. So even if fracking were to stop tomorrow, the threat of severe asthma won't stop. Again, the elevated risk of severe asthma was seen as far away as 10 miles from one or more fracked gas wells. Now, in Washington County, no one lives more than 10 miles away from a fracking well. In fact, most people live much closer to wells, but also to pipelines, compressors, processing facilities, and landfills, where the toxic and radioactive fracking waste is dumped, and all of the diesel emissions resulting from fracking activities as well. For the cancer study, the researchers examined the Pennsylvania Department of Health Cancer Registry between 2010 and 2019. They looked at only 4 types of cancer in children: leukemia, lymphoma, brain and CNS tumors, and bone tumors like Ewing sarcoma. And they found 498 cases in that 8-county area of Southwest Pennsylvania. The study found that children living within 1 mile of 1 or more fracked gas wells had 5 to 7 times the risk of developing lymphoma compared to kids living more than 5 miles away. No link was found to leukemia, brain and CNS tumors, and bone cancers. It's important to note, though, that while lymphoma is relatively rare, it's the 3rd most common type of cancer in kids under 15 years old, and it's the 2nd most common type of cancer in teenagers 15 and older. But lymphoma is much more common than Ewing sarcoma. So seeing the risk elevated 5 to 7 times was terrible news. And as a result, the study received enormous media attention in Pennsylvania and around the country, as it should have. The birth outcomes study used the Pennsylvania Department of Health birth registry data of more than 185,000 births in the 8-county area of Southwest Pennsylvania. And that study found associations between living up to 10 miles from fracked wells and low birth weight and small for gestational age newborns. They also found a well-known association of prematurity as a result of exposure to fine particle pollution, or PM 2.5, from any source, not just from fracking in southwestern Pennsylvania. This study confirms what others have already shown. There is something associated with fracking that is interfering with fetal growth. I want to repeat that because this is really important. There is something associated with fracking that is interfering with the growth of fetuses, of babies before they're born. The result is small babies and newborns who weigh less than those whose mothers don't live close to fracking. And also, PM 2.5 is dangerous to pregnant moms. Of course, we've known that for decades. PM 2.5 is dangerous for everybody. So all 3 studies added to the growing mountain of evidence showing that fracking is linked to health harms, especially in children. These are very significant and important findings. When Jim Fabisak presented the results at a public meeting at Cal University a few weeks ago, I called the asthma study a bombshell. But in retrospect, in the mind of this pediatrician, all 3 studies were bombshells. So that's it. Actually, one more slide, please, because I do want to talk about where we go from here. When you think about it, why would anybody be surprised by the results of these and so many other studies? Severe asthma, cancer, and poor birth outcomes have been strongly linked to fossil fuel pollution for many decades. Fracking isn't any different. Gas might burn a little cleaner than coal, but that's like putting a filter on a Camel cigarette. It may seem cleaner, but no doctor is going to tell you it's okay to smoke it. So there's already enough evidence, right, where actions are needed to protect people and the planet from harm. We don't need any new studies for Governor Shapiro, the Department of Environmental Protection, Department of Health, and the state legislature to adopt health protective policies, beginning with the 8 recommendations handed to Governor Shapiro when he was Attorney General by a grand jury in 2020. First, expand setbacks. Right now, the setbacks in Pennsylvania are 500 feet. That's way too close. There is a bill in the General Assembly, House Bill 170, that puts the setback distance at 2,500 feet from homes, childcare, schools, and businesses. But based on these 3 studies and so many other studies, 2,500 feet is probably still too close. Disclose all chemicals used during drilling and fracking. Doctors need to know so they can better evaluate their patients and treat them. Patients have a right to know what they are being exposed to. Parents have a duty to know what their kids are being exposed to. And so do first responders who may have to respond to a well pad fire, an explosion, a spill, or they may have to evacuate local residents. When permitting fracking infrastructure, the DEP should take into account all the other sites around a proposed site because they all add up and they result in cumulative impact. Doctors also need to understand that patients may live near a gas well, but also near a pipeline or a compressor station or a processing facility or a cracker plant where emissions also occur. And living near fracking operations also means living near practically nonstop heavy diesel truck traffic. Fracking, as you know, has a massive waste problem. Both solid fracking waste and wastewater are highly toxic and radioactive. It needs to be defined, regulated, and monitored. At the end of the day, though, we just have to stop making more fracking waste. In 2020, the grand jury called out the DEP and the Department of Health for being unresponsive and neglecting the complaints of residents living near fracking. Things haven't changed very much, I'm sorry to say, and it's time that they do change. The Pennsylvania government has been complicit in allowing fracking to expand rapidly in the state without holding the oil and gas industry accountable, and that behavior must stop. Education is also part of the solution. At the public meeting 3 weeks ago, the Department of Health made a few encouraging promises. They promised to educate schools on air quality and also to educate health providers, hospitals, and health systems around the threats posed by fracking. Of course, everyone knows that doctors get very little medical education about environmental health. Health impact assessments are tools that can help communities understand what a proposed project will mean for their community's health and safety before they agree to allow that project to move forward. Nonprofits like ours, like all of ours really, are continuing to educate lawmakers, health providers, and the public. And finally, over the years, Lois Bjornson, Kat Lodge, and others have taken politicians, journalists, health professionals, and faith groups on tours of Washington County. Others conduct frackland tours in northeastern Pennsylvania. In fact, I'm hoping to go on a tour next month in Dimmock, which is a community that lost its groundwater supply years ago, and they would like their water back. We're planning on taking some of the pit researchers and members of the Department of Health staff on a tour of Washington County, hopefully next month. And our groups are also planning to visit the State House with impacted residents in November, which will be the 4th anniversary of our fateful encounter with Governor Wolf that compelled him to announce the studies in 2019. And I'm not sure that keeping up the pressure is going to be beneficial in a corrupt and clueless state like Pennsylvania, but I have to remain hopeful. And with that, I'm happy to take any questions, or we can move on to the next speaker.
I will read you a couple of the questions in the chat. Do you foresee the ability to change the legal limits, which are currently OSHA-based standards, to reflect public health data instead of 8 hours a day, 40 hours a week, which, you know, doesn't make sense when we're talking about people living in a home full time? Do you foresee that as being a change?
You know, I think all of us have called for all sorts of changes on rules and standards guiding pollution, even if it's coming from occupational exposure. It's something that OSHA might be involved with. So history tells us that no, those standards are not going to change, at least to be more health protective. I hate to be cynical, but I think that's just what history tells us.
Yep. Nora, looks like you have your hand up. Go ahead.
Thank you. Dr. Kutayar, given the incredible inroads into public health and well-being and economic viability of the people of the state, really thinking out and thinking big, what could we be doing as citizens to really lean on state government to live up to their mission of protecting people's environment and just protecting us all. I mean, do we really need to limit ourselves to asking for more distance between people and these fracking infrastructure facilities? You know, I mean, it seems like we can find them a lot. We can demand bigger distances, but the damage has been just stunning. And this study really shows how acute it is. Any thoughts about, you know, looking at the biggest picture and the highest good for everybody in the state?
Well, you know, Nora, I think when you look objectively at human health, particularly human health in the modern age, at least since the beginning of the Industrial Revolution, I think it's pretty clear that most diseases, certainly cancer, but most modern diseases, respiratory diseases, heart disease, pollution has a basis for all of those diseases, and pollution from fossil fuel. And so looking at the big picture, what has to happen is we need to come to our senses and realize that how we're living, how we're using fossil fuels is simply not sustainable. I mean, it's killing people. It's literally it's not, I'm not being, I'm not exaggerating by saying that pollution from fossil fuels is killing people. That's the truth. And it's killing people in our state. It's killing people in our counties. It's killing people in our communities. That's just a fact, not hyperbole. It's a fact. And we know that it has to stop. So, you can argue about, well, these studies have limitations. There may be problems with them. No study's perfect. There's no absolute proof. Well, it's going to be hard to find absolute proof. But the bottom line is, this has to it has to stop. And if we're going to survive, it will stop. So it's really up to all of us. Most important thing is to talk to each other about this, whether it's about, fracking or the Shell cracker plant or climate change. Talk to people about it. You don't have to confront them, just talk to them, talk to each other. And that's the best way to start. I hope that all of us can find a way to lean on Governor Shapiro, though, to quit campaigning for president for the time being and, maybe help us out a little bit.
Yes, I agree. I once, waited for Governor Shapiro to talk to him about the East Palestine train derailment. I waited and took my moment. And that's kind of what we have to do, right? We have to keep engaging them. And as affected residents, we have to tell our story. So I agree with everyone in the chat. It looks like a lot of call your legislators. I absolutely agree. So thank you for being here. We are now going to elaborate on, some additional pieces of this study. And we have Dr. Gentile here, Debbie Gentile here to talk about the Beaver County Asthma Study and how you can get involved in that. Thank you.
Sure. Thank you very much, Hillary. I also want to acknowledge that Dr. Sally Wenzel is on this phone call, or Zoom as we call it. She is the co-investigator. There she is. So feel free to chime in, Sally. Go ahead and put my slides up. Some of you may know me. I've been very involved in looking at asthma outcomes in the Mon Valley. And we have actually shown that the impact of the air pollution down there is influencing both prevalence of asthma as well as severity. After the Clairton Coke Works fire, we were actually able to show a near doubling in the number of patients having asthma exacerbations related to that air pollution. And I've known Dr. Wenzel for a really long time. And since she's moved to Pittsburgh, we've talked about teaming up to, expand her asthma registry. And with all the things going on up in Beaver and the fact that we just don't know a lot of information about asthma up there yet, we thought this would be a great opportunity to work together. So I'm going to just spend a few minutes talking to you just about the nuts and bolts of this study that we're doing. So go ahead to the next slide. Really what we're going to spend time on over the next 5 to 10 minutes is what is an asthma registry? Why are we doing this? Who's doing it? who can participate, and what does it mean if you're participating. Next slide. And, Dr. Kataya really laid the groundwork for this. We know that all air pollution can lead to adverse effects with asthma. And certainly there are other environmental factors and even genetic factors and timing factors that play a role. But we definitely want to, know what's going on up there. So what's going on here is that we are doing an asthma registry. My nonprofit's Community Partners in Asthma Care, and we've teamed up with Dr. Wenzel's group over at the Asthma and Environmental Lung Health Institute. She's over at the Graduate School of Public Health at Pitt. And we're adding this on with the Breathe Collaborative, who has some funding to do more air pollution monitoring up there in Beaver. We're hoping to eventually be able to take these results and look at them related to what the air pollution monitoring results are as well. And I know many of you are familiar with that. It's in the process of being finalized and hopefully will be up and running soon. The big piece here are really the residents. The residents are the ones who are impacted. Dr. Wenzel and I have both done a lot of work in Allegheny County trying to understand the prevalence of asthma and its severity. We really don't know a lot about Beaver County. We really want to know what's going on up there with asthma and what are the factors that are influencing it, if any, and what can we do to help. And to really get there, we have to have a baseline understanding of where we are. Next slide. Why are we doing this? Again, Dr. Kataya mentioned much of this. Many environmental factors influence asthma, but not only asthma, there's other diseases as well, cardiovascular disease. You heard a bit about cancer and even prematurity and low birth weights. And again, our team is just so well positioned to do this. Dr. Wenzel has used her asthma registry to show that the Claritin Coke Works fire actually caused increased asthma symptoms and asthma rescue medication use in patients residing near Claritin during that time. She also has another publication coming out looking at how residents are redlined, and that has impacts on their asthma as well, if they're near these pollution sources. Again, we know a lot about the Mon Valley, but we really need to learn more about Beaver. And that's what we'd like to do. We want to get up there and know the people, try to understand their asthma, and try to get a handle on what's happening and help them. And again, we just really want to, try to, at the end of the day, improve health outcomes up there. We're all about educating people about the disease, all the different environmental factors, including air pollution, that play a role. But at the end of the day, we want to help people. That's what we're both in this for. Next slide. We're focusing on this upper Ohio River Valley area. Again, this is the region that the Breathe Collaborative has teamed up with many of your different groups up there to do the air monitoring project that's being funded by the EPA. So we're very much interested in Beaver and the surrounding counties up in that upper Ohio River Basin area up here. Next slide. We're already enrolling. We did start recruitment efforts probably 4 to 6 weeks ago, and I'm happy to say we have enrolled about 10 patients so far, and we've had calls from another 20 or so who are interested in enrolling. We would like to keep this going as long as we can. Our plan is to enroll about 500 patients with asthma. So certainly we have a long way to go. And if you know anyone in the area that has asthma, or if you have events in the community coming up where we can come and educate people about asthma and let them know about this registry, we'd be happy to join you. Next slide. So what's a registry? So this is, a question a lot of people may have. What a health registry really is a list of people or individuals who agree to let researchers review and study their medical records and also contact them about any future study opportunities. An example of this is Dr. Wenzel's had an asthma registry here in the Allegheny County area since she moved here years ago. And she was actually able to use the patients who had agreed to be part of the registry whenever the Claritin Coke fire cokeworks fire happened. She was actually able to contact people who had given permission to be in the registry and alert them that they were doing a study to see what the impact of that accident was on their asthma. So that allowed them to immobilize very quickly and respond to the environmental situation and assess the health effects of it. So that's really why we'd like to do this. And, you know, I can go on, but there's many medical advances that have resulted from studying registries. You know, we're not doing any experimental medications or treatments or anything like that with this. It's really just following patients, what their disease is, their signs and symptoms, and what's happening to them over time. But it's made many advances in different fields of medicine. So it's a very important technique in trying to monitor what's going on. Next slide. How do you do this? We actually have Allison Kohler. She is the clinical research coordinator in Dr. Wenzel's lab. Her phone number is here. Her email is there as well. The first step to learning more about this is to give her, you know, a shout out. And we actually have a flyer that was shown earlier, and I'm sure they'll show again, listing a little bit about the information. There's two options to complete the visit. We can actually do it virtually if patients would like to do that. In person, we've actually have office space available right up in Beaver. We're right on College Avenue off the main drag there, ground floor entry, free parking, so it's very accessible. The bus line runs right through there for the other communities nearby. But again, you can either come in person or we can arrange a virtual visit. Next slide. Who can participate in this? We're very interested in looking at children as well as adults. So anyone who's 12 and above, you know, they're eligible to participate. As time goes on, we'd like to start to enroll younger children, but this is where we are starting first. You definitely have to have a diagnosis of asthma to be enrolled. The teens and the adults, we do limit how much cigarette smoke exposure they've had. You know, and we can do that math for them. 20-pack year means that somebody smoked a pack of cigarettes a day for 20 years. It could also mean that they smoked 2 packs a day for 10 years. But we're happy to do that math if someone's a smoker and they're not sure if they're eligible. But really it's open to anyone 12 and above who has a diagnosis of asthma. Next slide. What do you expect? It's very simple. I've been doing research my whole career, and Dr. Wenzel has as well. And these are some of the easiest studies for people to participate in. You basically have a visit, and again, it can be virtual or in person, and it takes no more than an hour. I would even say it takes maybe about 45 minutes, 45 to 60 minutes. The first thing you do is the patient will give consent. We have a document that they read that makes sure they understand what they're participating in and that they fully agree to participate. So that's the first component, and that usually takes 10 or 15 minutes or so. And if someone has a question, we'll answer it for them. If someone changes their mind or they're not sure, we're fine with that too. We're not going to get mad at anyone. And then if they give consent, there's a survey that they complete. It's really just pointed questions asking about their asthma, how severe it is, how it impacts their daily lives. You know, do they need to go to the doctor for sick visits or the emergency room? You know, what type of medications are they taking? We're also going to use this to start to understand up in that area about allergies too. A lot of times, particularly in children, but sometimes in adults, environmental allergies like dust mite allergy or pet allergies and pollen allergies certainly can contribute to asthma. So we're going to have a set of questions that they can answer. And then you actually can do a breathing test. One of the tests is called spirometry, and it's office-based lung function testing. If you're going to see a doctor, a pulmonologist or an asthma doctor anywhere, this is one of the tests they would do, and the cartoon depicts it. It's very simple to do. A patient's instructed to breathe in and out into a mouthpiece. You know, and there's coaching involved. There's different feedback from the computer screen. Sometimes if they're children, we have them floating a balloon. There's often sound feedback. but it's really taking deep breaths in and blowing out as hard and as long and as fast as you can. So it's a very routine, non-invasive test. And then there's also a blood draw, so that if time goes on, we want to look at what we call biomarkers or signals within the body to let us know who has more severe disease, or if certain exposures are associated with the disease, we would have those samples. We are compensating the participants. They get $30 for their visit. And then, as I alluded to before, the beauty of this is once you're enrolled, if something would happen up there, let's say I don't want this to happen, but let's say there was just an incident and there was a lot of pollution released, we would actually be able to contact these people quickly because they've given consent to be contacted, and then enroll them in a follow-ups to see how they're doing. And our plan really at this point is, after we have the initial enrollment completed, to just routinely follow them on a regular basis regardless. Just because you participated now doesn't mean you can't participate in the future. Our plan is to really go back and reevaluate these people in a year, and again in 5 years, and so on, just to see what the impacts are. So really that's everything in a nutshell. I believe that's the last slide. Am I correct there? Perfect. If you have questions, we're happy to answer them. Dr. Katire talked a bit about asthma. It's a very prevalent problem. It's one of the most common chronic problems that impact both children and adults. It significantly impacts lives. There are people who can't sleep, they can't work. Children sometimes can't go to school. And unfortunately, people still die of this problem. So it's a very serious problem. And this is our passion. And what we want to do is learn more about this disease in Beaver County and try to help patients. So any questions you have, we're happy to answer. And, if you could unmute Dr. Wenzel, that would be great too.
Hi, everyone. And
Okay, she
thanks,
is.
yeah, thanks, Debbie, for giving such a nice presentation. I think, again, Dr. Katire presented very nicely about the effects of fracking on asthma, and the studies, I think, are very, very increasingly clear that there is an effect of fracking on asthma. We don't know what the effect of the cracker plan is. That's the bottom line. And so I think collecting information on people with asthma, as the plant has just opened over the last year, and then following people up a year later, 5 years later, as Debbie pointed out, I think is really important to help us understand, is there an impact of the cracker plant on asthma and on lung disease? And I would just add, and I know we're running late, that asthma, I think of as sort of the canary in the coal mine disease. And it's one of the first things that pops up when there's environmental impact. It's been used, canaries in the coal mine have been used obviously for years to detect problems in coal mines. Asthma is the first indication that there are problems with air quality. And I would strongly support and hope that people in Beaver County would be interested in giving us data that is really important to give to the state, to give to other legal entities, to really put restrictions and or change the way the oil and gas industry is operating in Pennsylvania.
Thank you. It looks like we have a couple questions. First, I will let David Smith go ahead and ask your question, please.
Hi, thank you. Great information, powerful information. What is BCMAC, Clean Air Council, Mark Dixon, those of you that have huge databases doing with this, going to do with this? There's 60 people here now. Can we assign people 10 phone calls to make? I mean, it's just something we're just going to continue to repeat and repeat and repeat. Or are we going to get in the trenches and do something about it and get people on board with this and make Shell really nervous and threaten their existence instead of being passive with this?
Yeah, thank you. So I will speak as a BCMAC employee and organizer. We are going to do something with this. We have a series of events that are coming up. We have some canvassing actions towards the end of the program. I'll share that with everyone. but we definitely aren't going to sit on this. And I think, you know, we can do a really good job of sharing this on social media and throughout, you know, email campaigns and things like that. What's really great is there are a lot of, you know, environmental organizations that are national that are actually putting money into hiring people just to work on Beaver County. That's how important this is. There are NGOs sending people here. I meet every week, only one, Food and Water Watch. There are multiple different groups that are actually getting employees just for Beaver County. So we've been organizing a lot over the summer, and we're ready to hit it with some fall events, canvassing, text campaigns. So if you can make it to the end of the program, I promise I'm gonna drop everything in the chat so that we can hit them where it hurts.
Thank you.
Yeah.
Of course.
Hillary, it looks like someone is asking us to, distribute to them the Facebook ads I had, as well as the flyers. So I'll make sure we resend that to you guys so you have it to distribute. And I'm also putting my email right in here too. If anyone wants to reach out, I'm happy to interact with you and come to the events. So is Dr. Wenzel and her team. We want to get people excited about this and make sure they know about it. And we want to be wherever you are with this.
Absolutely. We'll make it happen. It looks like Bob has his hand up. Let's hear it.
Yeah, we should be extremely alert and aware of all of the asthma potential that's coming to Beaver County. We don't have to look very far. We need to look at Clairton. And on a Zoom call that I was on, one of the residents was talking about their children had asthma so bad that child welfare came and took their children off of them and moved them out to a safe area. The parents couldn't leave because their jobs were there, didn't have the money to change their home. Is that what Beaver County is going to be looking like when this cracker plant goes full blast? I'm very weary of the potential that's what's going to happen here. We can't have our children taken from our homes. We can't. And I was working with a lady from Pittsburgh who was running for Congress, and her child had asthma. And she said that was the most frightening thing in her life, to watch her child sucking for air and didn't know if he was going to die in front of her. These things really affected me as far as the asthma situation that goes on now. Not that we're thinking about it, it does go on here. And I think people need to get educated as to what is happening and what can we do about it to prevent and to knock down the sources that just keep coming up one after another after another. So those are my fears. Maybe the doctors have something to say about that.
Yeah, Bob, I've spent a lot of time down in the Mon Valley, and I've gone to so many community events, and we have presentations and flyers, or we have all types of things that we can use to help educate people about asthma. And again, we don't know for sure what's going to happen, but we're concerned. That's why we want to be up there doing this. And I know Dr. Wenzel spends a lot of her time, and her team does, trying to do community outreach to educate. So we're all very happy to come to any of the community events and try to raise awareness. I do have a nice little lecture put together about what it's like to have asthma. I didn't do it tonight just because, we're trying to focus on letting everyone know about the registry, but we're happy to come up and do those types of things with you.
And I think that would be wonderful.
And certainly, Bob, to your point, I think we do have increasing amounts of data that asthma in traditional Rust Belt cities, not just Pittsburgh, there are other cities that have historical pollutions and current pollutants besides Pittsburgh, but is particularly bad and very prevalent. And until I think we come to grips with this constant struggle between the economy and health, the health side will lose.
Yeah, unfortunate. Bob, it also looks like a Ron Denham would like a source from that statement. So if you could just put in the chat, where you heard that story, that was truly terrifying. So thank you. And it looks like we have time for one more question. Terry, I see you have your hand up. You're muted, Terry.
Apologies. Thank you to all the Pitt researchers and Dr. Katayer for this work. And I just want to say that in some way, to an extent, we don't have to reinvent the wheel. Clean Air Council has been working for several years now on a setbacks campaign, and it's called Protective Buffers. I put the link in the chat. And, the Attorney General's recommendations, 8 recommendations based on the grand jury study of fracking in 2020. The top recommendation was put 2,500 feet of distance between frack wells and homes. And this Protective Buffers campaign, if you go to that website and use it to call your legislator and ask your legislator to support this, do all you can to push for it. It addresses 9 types of fracking infrastructure. So not just wells, but pipelines and injection wells and compressor stations, and the whole, and all of it is dangerous and unhelpful for people. So that's a place to start. And pressure on your legislators really makes a difference. They're not going to move on this without pressure from the public. So I just hope everyone will do that. Thank you.
Thank you. And Terry, I'll let you drop that link again in the chat. I believe you posted it earlier.
Sure will.
Thank you, everyone. We have more information. I know this is a lot, but I promise that, this is important. So we also have Rachel Ayer tonight, and she's going to talk more about the University of Pittsburgh study. And after her presentation, we'll get to some community updates and how you can get involved. So welcome, Rachel.
Hi, thank you so much, Hillary. I am a graduate student at the University of Pittsburgh School of Public Health. I don't see my slides. Perfect, thank you. And the principal investigator of the study that I am a student researcher on, Dr. Jim Babiziak, is also in attendance here, along with co-investigators Janine Buchanan and Dr. Hannah Covert. So if there's any questions at the end, they'll probably jump on and assist me with answering those. So I'm going to be talking today about some preliminary results from a community health study that we are currently conducting in Beaver County, along with some next steps for our project. Next slide, please. And the first phase of our study involved administering a community health survey to adult residents of Beaver County. And this survey was administered on a rolling basis from July 2022 to August of 2023. And so we've been collecting data from participants from before the cracker plant opened until recently. And the purpose of the survey is to collect demographic information along with information regarding current health perceptions and perceptions regarding environmental risk factors. Next slide, please. And so we measured these health perceptions through a series of 13 statements where the survey taker can respond with either that they agree with the statement, that they're neutral towards, or that they disagree with the statement. And for the sake of time, I'm just highlighting 5 of the results that we've gotten so far. So the first 2 percentages that I have up there are results from asking participants if they feel that their health has been harmed by air pollution or unsafe drinking water. And so 36% of participants indicated that their health had been harmed by air pollution, while 25% had indicated the same regarding unsafe drinking water. 71% of participants believe that local industry contributes to air and water pollution, while 39% of participants indicated that they are not satisfied with the environmental practices of local industry. And then finally, 19% of participants do not agree that fossil fuel sources are economically important to the future of Beaver County. And I just want to emphasize that these are health perceptions, so we didn't ask anyone to explain their responses at this point. So next slide, please. And the overall goal of this survey is that we wanted to collect this baseline information prior to the opening of the cracker plant that we will use to compare to perceptions after the cracker plant has begun full operational activity. So we wanted to see if there's any change that we could maybe link to the, I guess, the effects, like the economic impact or the industrial impact of the cracker plant being operating. And so the next steps for the survey are that we're going to begin redistributing to the survey takers that took that original baseline survey, starting with those who completed it at least a year ago from now, to see if there's been any changes in their responses. And next slide, please. And so going from there, I also wanted to share our projected phase 2, which will include biological and non-biological specimen collection. Next slide, please. And before I get into it, I just wanted to touch briefly on a couple of chemical groups that I'm going to be referencing when I'm explaining the rationale and the next phases of our study. So the first group of chemicals are PFAS, and this is an umbrella term for a group of man-made chemicals that have been used since the 1940s. They're found in thousands of products like nonstick cookware and furniture and carpets and you name it. They are aptly named forever chemicals because we cannot get rid of them. They do not degrade over time and have been accumulating in our waterways and in our soil, and have now entered our drinking water supply and our food sources. So the CDC estimates that somewhere from 97 to 98% of Americans have PFAS in their blood at this time. And although the full effect of PFAS on human health is not entirely known, there have been studies that have linked elevated PFAS levels in blood to conditions like high cholesterol, low infant birth weight, and higher risk for certain cancers. The next group of chemicals that I want to cover are volatile organic compounds, or VOCs. These are also man-made chemicals that can be found in household items like paints and lacquers, along with industrial materials like solvents and water treatment chemicals. They're released as a gas, so they contribute to air pollution, and they are known to cause organ damage, along with being known to cause cancer as well. Next slide, please. And so getting into the rationale of what our next steps are going to be, we will be interested in measuring PFAS exposure levels in participants. And the reason behind that is that one of the co-investigators on our study, Dr. Carla Ng, has been conducting a series of water collections on the waterways surrounding the cracker plant. And I showed those collection sites with yellow stars, and then the side of the cracker plant is marked by that red location pin. And although the PFAS levels have remained relatively consistent within most of the collection sites, the 5th collection site, which is immediately downstream of the cracker plant, was shown to have increased PFAS levels after the beginning of operation of the cracker plant. So next slide, please. And then secondly, we're going to be interested in measuring VOC exposure levels in participants. And that comes from 2 things. The first, I'm sure many of you are aware that the cracker plant has exceeded their 12-month VOC emissions for the year. And we also have been using this air monitoring network. It's called Purple Air. And there are sensors that are continuously monitoring the air located around the cracker plant. I included a screenshot of a reading there where the cracker plant is marked as well by that red location pin. And the levels of VOCs according to the purple air data, show that they're elevated. And I'm getting that from the circles that have numbers in them. They're color coded. So the more purple it is, the higher the level of VOC is as well. So taking all of those three things together with the PFAS and the VOC, it can kind of explain our reasoning for this next step of our study. So next slide, please. And so moving from there, we are hoping to identify 60 what we're calling high priority participants for follow-up. And we're calling them high priority because, let me also explain that these participants are coming from the survey as well. So they are high priority because they live within a zip code that is within a 10-mile radius of the cracker plant, along with potentially living in an area that has higher levels of air pollution attributed to the cracker plant. Next slide, please. And so the first test that we would like to, or the first follow-up to this, is we want to collect a biological specimen in the form of a blood sample. And this blood sample will be used to measure personal PFAS levels within participants' blood. And we will be distributing these PFAS at-home test kits that are produced by this company called EmpowerDX. Participants will be asked to submit a blood sample from a single finger stick that will be mailed to the EmpowerDX laboratory for further analysis. Participants will be receiving their test results within a few weeks from there. And then next slide, please. And then finally, for our non-biological specimen collection, the first one that we will be using are silicone wristbands. I included an image of one on the right. And these will be used to measure personal chemical exposure levels, but most importantly, measure VOC exposure levels. So participants will just wear them for 7 days, and then after 7 days, they'll package them up and then send them to the University of Pittsburgh, where we will be doing analysis on them in our laboratory. And they'll also be asked to complete a questionnaire that gives us a better idea of what their day-to-day activities are, and that will help us better understanding the analysis results, or the results of the analysis. And then finally, we will be collecting dust samples from participants' homes. So we'll be using a Swiffer dry cloth to pick up dust samples, and we will be analyzing them at the University of Pittsburgh to test for the presence of PFAS home level exposure. And next slide, please. And that is all that I have at this time. Thank you all for listening, and I am happy to answer any questions. And then do you mind going to the next slide, please? And I just wanted to include a QR code that will take you to a screener for our survey. So you are eligible to take it if you are at least 18 years old and a current resident of Beaver County, and participants will get a $10 gift card for taking it. So that is all that I have, and I am happy to take any questions.
Mark, go ahead.
Hey there, Rachel, really nice job. I'm so glad to see that you're using the purple airs. I just also wanted to caution you that the VOC readings on the purple airs are not the most reliable. They are super nuanced. There's all sorts of details about what you can read and what you can't read from them. The older batch that started with the deployment there, they can go up and down a lot, and that doesn't necessarily equate with pollution. There's some newer ones that have a little better reading on what is and isn't pollution. But I'm happy to talk with you offline if you want to learn more about what you can and shouldn't interpret from the purple airs. Happy to do that. And I just want to caution everybody on the call that if your purple air is reading extra high for VOCs, that is not to be read as an indication that you're being polluted all to hell. There's many things it could mean, but it's best to check with someone like me. I'll put my information in the chat. You can just text me and say, hey, Mark, this purple area is off the charts. What's going on? And then I'll tell you, okay, based on what I see here, it is or isn't something to worry about, or I don't know. And that's often what it can be. And let's learn more. So just want to like, the VOC readings are definitely like, they have a lot to be desired, and Purple Air is working on them, but they're not baked yet. Thanks.
Thank you for clarifying that, Mark. I should have specified that, yes, it is preliminary and experimental and not a hard fact. But it is useful in some regards, and it is good to have somebody like you. I think interpreting that information can be pretty convoluted. There's not a lot of information that at least, I mean, even I have a hard time interpreting what it means. So yes, thank you so much for that.
Yeah, absolutely. And again, I'm so glad you're using them. So it's just every time I hear someone using the Purple Airs, it warms my heart. So thank you.
And so, Mark, could I just chime in real quick and just to point out that that's actually the precise reason that we need to have something more specific, such as the wristbands or whatever, which will actually enable us to extract and measure individual compounds that people are exposed to. So that's exactly the limitation we are trying to overcome.
Yeah, and it's so valuable and important. And Purple Air is working on new ones, and we're trying to like gradually roll out newer models that have better specificity or better readings, and they're always getting better. But yeah, I'm so glad. I love to see those wristbands and everything. It's awesome.
Wonderful. Well, thank you, Rachel. Speaking of Shell, we're going to do a quick plant update with Dr. Lau. Cliff, do you want to fill everyone in with the latest of what's going on at Shell and what we've been trying to uncover and research?
Yeah, a lot's been going on. And this is part of what Dave Smith and stuff, and also with the observations, talking with Dr. Fabizak of this portion. This is the audience participation part. This is Eyes on Shell. So the first thing I'd like to ask is, has anybody like to report since our last meeting of what they have observed, what Shell has been doing or something? You have reported to us through emails and other contacts, but just to give anybody an opportunity to further do it, and then I can talk about what we've seen from observation. So does anybody